Hello everyone, welcome to my video. In this video, we'll be discussing the keto diet. The keto diet is a low-carb, high-fat diet that has been shown to have many health benefits. How the keto diet works. Our bodies use carbohydrates as their main source of energy. When we reduce our carbohydrate intake, our bodies will break down fat into ketones to use as energy. This is called ketosis. Latest information. In addition to the information that has been mentioned previously, here are some of the latest information about the keto diet. The keto diet can help improve heart health. A study published in the journal The American Journal of Clinical Nutrition found that the keto diet can lower LDL cholesterol, bad cholesterol, and increase HDL cholesterol, good cholesterol. The keto diet can help improve brain function. A study published in the journal Neurology found that the keto diet can improve brain function in healthy adults. The keto diet can help treat Alzheimer's disease. A study published in the journal Nature Medicine found that the keto diet can slow the progression of Alzheimer's disease. The keto diet can help treat Parkinson's disease. A study published in the journal Annals of Neurology found that the keto diet can reduce the symptoms of Parkinson's disease. Benefits of the keto diet: weight loss and fat loss. The keto diet is one of the most effective diets for weight loss. This diet can help you burn more calories and fat. Improved blood sugar control in people with type 2 diabetes. The keto diet can help people with type 2 diabetes control their blood sugar levels. Reduced risk of heart disease. The keto diet can help lower LDL cholesterol, bad cholesterol, and increase HDL cholesterol, good cholesterol. Preventing epilepsy in children. The keto diet is one of the effective treatments for epilepsy in children. Improving brain function in people with Alzheimer's disease. The keto diet can help improve brain function in people with Alzheimer's disease. Reducing acne. The keto diet can help reduce acne. Helping manage PCOS. The keto diet can help manage PCOS, polycystic ovary syndrome. Inhibiting the growth of cancer cells. The keto diet can help inhibit the growth of cancer cells. How to follow the keto diet. To follow the keto diet, you need to limit your daily carb intake to 50 grams or less. This means you need to avoid foods like bread, rice, pasta, potatoes, and high-carb fruits. Instead, you can eat foods that are high in fat and protein, such as meat, poultry, fish, eggs, cheese, cream, oils, olive oil, coconut oil, MCT oil, low-carb vegetables, broccoli, cauliflower, spinach, kale, etc. Here are some tips for following the keto diet safely and effectively. Start slowly. Don't immediately cut your carb intake drastically. Start by gradually reducing your carb intake until you reach 50 grams or less per day. Make sure to stay hydrated. The keto diet can cause dehydration, so make sure to drink plenty of water and electrolyte drinks. Consult with a doctor before starting the keto diet. If you have any underlying medical conditions, you should consult with a doctor before starting the keto diet. Risks of the keto diet. The keto diet is generally safe for most healthy people. However, there are some risks to be aware of, especially for people with underlying medical conditions, such as kidney stones, digestive problems, nutritional deficiencies, increased LDL cholesterol, hypokalemia, low potassium levels, hyponatremia, low sodium levels. The keto diet is a diet that can have health benefits and weight loss. However, it is important to follow the keto diet safely and correctly. If you have any underlying medical conditions, you should consult with a doctor before starting the keto diet. Start by tracking your food intake. This will help you ensure that you are consuming enough fat and protein and not too many carbohydrates. Find keto-friendly recipes. There are many keto-friendly recipes available online and in cookbooks. Join a keto community. There are many online and offline keto communities that can provide support and motivation. The latest information about the keto diet shows that this diet can provide a wider range of health benefits than previously known. For example, the keto diet can help improve heart health, brain function, and even treat Alzheimer's and Parkinson's diseases. However, it is important to note that the keto diet is not a miracle cure. This diet is still under research, and there are still some risks to be aware of, such as kidney stones and digestive problems. If you are considering following the keto diet, you should consult with a doctor first. Thanks for watching. I hope you found this video helpful.